Good afternoon, ladies and gentlemen. Welcome to this new segment of Medcast, which is a new gateway to your medical updates and the rumors we have in society. Dementia is a term used to describe a range of symptoms affecting memory, thinking, and social abilities. It is not a specific disease, but rather than a group of conditions that lead to cognitive decline. That's why we have today the consultant of family medicine, geriatric medicine, palliative care, and gero-oncology, Dr. Nasser AlQuraini. Welcome, Dr. Nasser.
Thanks so much for having me.
We are so pleased and honored to have you today, and we have so many subjects to discuss regarding the geriatric medicine.
Yep.
Dr. Nasser, firstly, let's start with what we started in our introduction, which is the dementia. What is actually the dementia?
So dementia, it's I would say a complex or multiple symptoms and signs that usually associate with cognitive decline that is associated with functional decline. So it is sometimes normal that somebody will be forgetful, forget some events or forgetting some appointments or misplacing items and so on. But when it is associated with functional decline, which means that we have difficulty in conducting or doing our basic activity of daily living, that will be considering functional failure, which we call it a dementia disorder.
Okay. Do we have different kinds of dementia, or is it just one diagnosis?
Yes, a very good question. We have multiple types of dementia, which is the most common that everybody can or probably hear about is Alzheimer's disease, which is considered to be 60 to 70% of all dementias. And then we have the most second common, which is considered to be very common here in the Gulf or Kuwaiti society, which is the vascular dementia, which is usually associated with strokes, vascular diseases like hypertension or atrial fibrillation or diabetes. And then we have Lewy body dementia. And then we have also Parkinson's disease dementia. And then we have frontotemporal dementia. And there are some very rare types of dementias.
Okay, now as a piece of advice for caregivers, you normally, like we have our brothers and sisters who are having their fathers and mothers. How can we tell them that the early signs of dementia?
So this is very important because most of the dementia patients that we are encounter in our clinics are coming in moderate stage. They don't come early, so we can interfere and probably we can steer the progression of disease. So the early signs I would suggest for anybody or caregiver to pay attention is the change of lifestyle or change of the routine of the elderly or the elder adult. So if he change his norms like probably becoming less social or interrupting his routine, like if somebody is going daily into the mosque or gathering like in duaniyas or have the social gathering and this is changed. So I would pay attention to that change in routine and also getting things like if a mother or a grandmother used to cook or used to arrange things in a certain way in their home and they stop doing that and become less social, become more isolated, and there is some difficulty in finding in some words while they're having conversation. I would be suggesting for them to have them to see a specialist in that area.
Yeah, that's great. Now, the question is the dementia limited to a certain age group or can happen at any age?
Yeah, actually, it can happen to early age. I mean, midlife, and there was a very interesting case happened like 2 years ago in China. There was a small boy who was in his 18 years of age, and he was diagnosed with Alzheimer's. So dementia could be happening in early stages, and that's usually associated with family inheritance.
Oh, okay, that's great. Now, is there like any scientific-based causes of dementias that can we like avoid or sometimes advise our parents or relatives to avoid the dementia as much as possible?
So yeah, aside of the genetic inheritance mode, which usually happens with Alzheimer type of dementia, usually optimizing our lifestyle, like controlling our chronic disease like hypertension, diabetes, hypothyroidism, replacing vitamins like B12, getting into more active lifestyle, and because we have here in our society, it's more like to sedentary lifestyle other than it's not like an active lifestyle. Having walking or jogging for 30 minutes per week, Also stopping smoking, some alcoholic drinks also that can affect or increase the risk of having dementia. Having a good sleeping pattern that will be also reduce the risk of dementia. Getting more socialized, learning to have more challenging habits like learning a new language, learning more
New skills, let's
new
say.
skills,
Yep.
exactly, like gardening or having some readings or engaging in some other activities like more physical activities that will also reduce the risk of cognitive decline or dementias.
Okay, I believe that the gardening skills that you have mentioned is more applicable to Canada rather than Kuwait because it's very rare we have gardens here.
Exactly, but
Yeah.
also if having some indoors gardening that
Yeah.
will also increase and motivate the cognitive function.
I can see now some people are directed to have the indoors gardens or at least in their backyards in the homes. So they try to have like a small gardens or try to do some activities in the backyards. Now, can we say that dementia can affect the brain in a physical way?
Yeah, actually, like in Alzheimer's and also Lewy body and Parkinson's disease, there will be some deposits in the brain, like the amyloid or tau protein, will affect some certain parts of the brain that physically affect the brain. It causes brain shrinkage. It will kill some brain cells, and it causes the symptoms. Sometimes the symptoms could be physical by having difficulty in coordinating the daily activity, and sometimes it could be emotional and psychological, which is some dementia patient will have visual hallucination. They have verbal or sometimes physical aggression, so that those proteins can affect the brain and in physical ways.
Okay, that's very great. Now, I have heard you mention the family history could be like one of the risk factors of having dementia. How significant is that?
So if family diagnosed having the gene, which is the APO protein E in their genes, so that will be that carry a very high risk for the family will have an early onset of Alzheimer dementia. So we suggest for families who have the dementia started in early age, which I mean like in the mid of 30s or the 40s of their age, to have the genetic screening to know, and that will benefit the family members to have some goal of care, arrange their life, I mean in legal way or on social way. And also that will have some marriage counseling. So that will be the benefit of genetic counseling.
Okay, regarding preventing dementia, in the space of the social media, we do have so many people that can discuss the ways to prevent having dementia for the older people. Now, sometimes we hear some people say that the diet style or the let's say the healthy lifestyle can play a key role in preventing dementia. Is that correct or not?
Well, actually, like a few years ago, there was a systematic and review and meta-analysis came out suggesting that having Mediterranean style, I mean, with the food and having a physical activity on daily basis, changing, having also challenging tasks every day, as we mentioned, learning new languages, do some gardening, or even playing an instrumental, like a musical instrument. Having groups of patients who were having the mild cognitive impairment or early stages of dementia, actually it improved the cognitive function to the point that some of the patients return back to a normal cognitive function. So having those all optimized all together, that could actually treat some form if it's caught in early stages, that could improve the cognitive.
Do we have some medications now before discussing the treatments available we have for dementia? Do we have any medications that could prevent or at least make the dementia comes later than it is supposed to come?
At this stage of medicine, still, unfortunately, we don't have something to prevent dementia from happening. And I mean, as a pharma perspective, but there is some researches that could suggest or it signals some result that it might in the near future we have something in hand.
Okay, how about treating dementia if it happens to the patient?
So treating dementia, we have almost four pillars of treating dementia, starting with the first group, which is the choline esterase inhibitors. The benefit of those this group of medication is it slow the progression of dementia, or it stabilize it. So we have 30% might improve, 30% will stabilize, but unfortunately there is 30% which will not have no benefit from from this group of the medication. We have the memantine, which we usually use it in the moderate to severe stage of dementia. We usually use it as an add-on onto cholinesterase inhibitors. This is for both of those groups. We usually use for improving the cognition. We have the two other pillars, which is the antidepressant, which we use for the psychological and behavioral symptoms of dementia. And we have the antipsychotics when we have psychotic features, like we have a very aggressive behavior, or we have the delusion of security, or we have the visual or auditory hallucination. We treat those symptoms with those groups.
Okay, that's very great, because some people might think that treating dementia will only target the dementia itself, or the, let's say, the hormones or the chemical precursors inside the body. But you have mentioned that you might use antipsychotics as well to treat dementia. Now, one more last question, based on your back in your time in Canada, did you find any difference between the Canadian society compared to the Kuwaiti society? That's why we might see that the dementia is a bit late at age in there.
Yeah, because maybe geriatric medicine was started a little bit earlier, I would say, in Canadian settings. So the awareness about dementia overall has become more available. I mean, and there is multiple resources in the Canadian setting and social settings. So caregivers understand that there is a disease, there is a resource that they can lean onto, and there is multiple medical specialties, which is not only inclusive about geriatrics. It could also be diagnosed by neurologists and also by psychiatrists. And there is some groups that they can also be in contact with, and there is the Alzheimer's Association, which provide a lot of materials for the caregivers. I think here in Kuwait we also get to some point that it's improved from 10 years ago, and with forming the geriatric association, we are looking forward to improve and making a lot of resources to the Kuwaiti setting and the social setting, especially for the caregivers, so they can seek help. And we are hopeful that we spread the awareness about the cognitive decline, and hopefully with the new generation of medication that we are hoping that it will help dementia, like the monoclonal antibodies, that we can treat dementia in early stages, and hopefully in the foreseeable future we can prevent dementia from happening.
Dr. Nasser, we are so pleased to have you today, and your speech was very great. Hopefully we can have you again here in the studio.
Thank you so much.
Thank you so much. Our dear viewers, we have reached to the end of our segments with Dr. Nasser AlQuraini. Hopefully we can meet you again with another medical professional. Until that time, see you later.